We're finding that there are too many communities, including many in Illinois, where kids are suffering from high lead levels traced to drinking water or lead-based paint. There was an analysis by the Associated Press looking at EPA data from nearly 1,400 water systems in 41 states since the year 2013. One of our communities downstate, Knox County, home to Galesburg, Illinois. In that county, 1 out of every 20 children under the age of 6 had lead levels exceeding the state standard. It's a problem in Chicago as well. In 2012, an EPA study found high levels of lead in drinking water in several Chicago homes where water mains had been replaced or new meters installed, despite the city's use of chemicals in their water supply to suppress lead. Just last week, the Chicago Department of Public Health announced it would begin water testing programs for communities with homes where children have experienced lead poisoning, particularly on the south and west side. It's a good step, but we need to do more. We know that old lead pipes and lead-based paint can cause high lead levels in children, and that high lead levels, as I said earlier, are a danger to these kids. We also know that replacing every old lead pipe is virtually impossible, but we still need to do more in Washington to help identify the households at greatest risk and help provide the resources. I support increasing funding for the Safe Drinking Water Revolving Loan Fund, which helps local communities and public water systems finance infrastructure to provide safe and clean water. We need to reaffirm our nation's commitment to reducing lead poisoning, and I'm working with my colleagues in the Senate on a package of bills we'll roll out soon on the subject. We discovered something as a result of a series done by the Chicago Tribune. They discovered that the standard for lead contamination was different between the Housing and Urban Development Department and the Center for Disease Control. In fact, HUD accepted standards when it came to lead paint and contamination 4 times higher than the Center for Disease Control. Well, I called the Secretary of HUD into my office a couple weeks ago and asked him to explain it. He said, I can't explain it, and we're going to change it. That's a step in the right direction. But there are other parts of this too. If you have a family that has some help in paying for their housing, and they're living in a place with lead paint, and it's a danger to the kids, and the blood tests show that this danger is a reality, what is that family going to do next? We have to make sure that they have alternative places to live that are safe, and HUD needs to work on that, and we will work with him. I also introduced the Copper and Lead Education, Assessment, and Reporting Act of 2016 with Ben Cardin, my colleague from Maryland. We include in that package requirements to address the testing of water supplies across the United States. In cities like Chicago, where nearly 80% of the homes are connected to pipes that contain lead, it's vital that our testing standards detect elevated levels of lead. An EPA study recently revealed our testing protocols in Chicago are likely to miss high concentrations in drinking water. Our bill would direct the EPA to develop new ways to report testing and monitoring of lead. Flint, Michigan reminds us of what happens when spending cuts become more important than the health of our kids. We can't stand by and watch millions of our kids have their health and future jeopardized. We need to ensure we have the right regulations and the right protections. And we need to help local communities. We're going to need a helping hand to replace these lead pipes and to protect kids from lead paint. Access to clean water and safe housing should not be determined by your zip code.